Welcome back to the show, everyone. I'm your host, Tim Walcott. I'm here with my co-host, Tyler Paterson.
Hello.
Ty, what episode are we on? I don't even know.
Episode 57, man. Crazy.
Sweet. Okay, so we're on episode 57. Usually we prep that beforehand, but I was slacking. We're here for a roundtable discussion on stretching, all things stretching. We have three other guys here present with us. We'll start with Matt McCallum over there. And Matt, if you could let us know, obviously they know your name, tell us what you do, and then we'll move on to Morrow and then Dr. Kyle.
Great. So my name is Matt McCallum. I'm a personal trainer at the Good Life Fitness in Orangeville, Ontario. I've been there for almost 4 years now. I also do fascial stretch therapy at the club as well. That's me.
Cool. Morrow?
Awesome. Tyler Morrow. This is I'm kind of like a part-time guest here on the Between Sets podcast, and we'll create a little bit of content, help the boys out. So I'm a second year chiropractic student. I have just some experience in strength conditioning, personal training, and passionate about all things human body.
Love it.
Sweet.
Kyle.
I'm Dr. Kyle Aram. I'm a chiropractor, 2 years into practice now. I worked at Active Therapeutic Solutions in Guelph and Shift Family Health Center in Fergus.
Awesome.
Beautiful. So everybody should know this. All three boys have been on the podcast before. So if you haven't heard their discussions already and their podcast episodes, you should immediately go to their podcast after this and listen to all three.
That is true. We should probably know what those numbers are, but we have no idea.
Yeah, we're not actually good at podcasters.
Nope, not at all.
Yeah.
So you can definitely go search. You can go search Between Sets, go to all episodes, and keep scrolling because you would just scroll Instagram anyway.
Yeah.
So today's going to be all about stretching, guys. So the goal and objective of this discussion is essentially going to be exploring different perspectives and opinions on whether or not certain kinds of stretching can be reconciled as part of a client-centered coaching approach or treatment. So that's kind of the main idea, especially with the vision of Motus Strength Health Club being founded upon a value of self-efficacy and trying to increase client positive beliefs, independence, and autonomy. So we talk about stretching all the time, definitely off mic. So I thought kind of getting everyone on a podcast at once to get some different voices on it would be useful. And then hopefully this provides some value for others as far as maybe even other, chiropractors, massage therapists, personal trainers, FST people, whatever, over like, how and why, or if why stretching is important to them and how to apply it. So I think that would be a good idea, especially because I think around stretching, depending on which circles you run in, you may get a black or white type of conversation where it's like people are all for it or all against it. I know Tyler Paterson and I have been pigeonholed as that in the past.
Definitely.
And like, while I've been personally a little bit more, maybe absolute on my opinion of it in the past, and like now it's definitely a little bit more tempered. And even then it wasn't that crazy, but I think people hear what they want to hear. But yeah, anyways, let's go over some definitions. So Morrow, I'm going to throw this one to you. Tell the people, what is stretching essentially? Because I think something like this definitely needs to be defined, particularly when we know that stretching is just this massive umbrella. So yeah, just go over definitions, and then Matt McCallum, if you can take it from there and just explain a few different types.
Yeah. So when we're talking about stretching, there are a few types of stretching that we've all heard about. I'll let Matt dive into that a little bit more, as Tim said. But essentially, generally, when you hear stretching, you think about static stretching, which is usually holding a joint at its end range of motion from anywhere from a range of 10 seconds, 60 seconds. A lot of the literature that's out there is about 10 to 30 seconds in terms of holding a static stretch. When you get into the idea of stretching, what you're trying to do with stretching is you're trying to usually increase your range of motion, flexibility, or mobility. So flexibility, you would describe as the range of motions of your joints and the ability of those joints to move freely. And the idea of range of motion would be the distance and direction in which your joints can move. And now that can be in a combination of joints, or it could be a single joint that you have. And then when we get into mobility, which is definitely like a hot topic on the Instagram and other realms of the fitness industry, it's essentially just the ability to move freely without any disturbances. So oftentimes you'll hear that people have good mobility, bad mobility, and I think we just have to pay a little bit more attention to the narratives that we kind of use to describe mobility for ideas, for the tasks that we're looking to perform, and whether or not like movement is good or bad, because a lot of that can be subjective based on the person who's completing the movement, or the coach or trainer or clinician who is trying to prescribe movement and create more self-efficacy, as we talked about on the last episode about in terms of trying to get people to move more and incorporate exercise into their everyday life a little bit more. So that's just a brief overview of the definitions. In general, as I mentioned, static stretching is usually what we think of, but dynamic stretching, which can also be kind of included like dynamic warm-up, stuff like that, is another type of kind of like stretching that you see. And I'll let Matt kind of go into that and talk about some different types of stretching.
Cool. Yes, we've got 7 different kinds of stretching. I'll go through all 7 now, name them, give a bit of a definition, and I've got a couple examples here just in case the definition doesn't clear up what it is. So the first one we've got is ballistic stretching. So that's the use of momentum, moving the body or limb in an attempt to force something beyond a range that you currently have. An example of this would be like bouncing down repeatedly to touch your toes. Say you were trying to do a standing hamstring stretch. We've got dynamic stretching, which involves moving a body part and then, gradually trying to increase your reach. So say a leg swing while you're holding onto the side of a squat rack, trying to get your hips and hamstrings going pre-workout. We've got active stretching, which is assuming a position and holding it. We've got passive, which is assuming a position and holding it with another body part, which could be an example of this, like some people have different names for it, but like a figure 4 piriformis stretch, where you've got the ankle of one foot on the quad of another and holding. We've got static stretching, which Tyler just spoke about, which is stretching a muscle to the farthest point and then maintaining that from 10 seconds onward, like Tyler spoke of. We've got isometric stretching, which is a static stretch with a contraction throughout. And then we have PNF stretching, which is proprioceptive neuromuscular facilitation, which is kind of a combination of passive and isometric, where you're holding a stretch, trying to contract said muscle for, I usually prescribe about 5 seconds or so, relaxing, and then ideally trying to be able to go deeper into that stretch, such as a couch stretch or something of that nature. So those are the 7.
Perfect. Thanks, Matt. Ty, did you I don't really know much about PNF stretching, but weren't you interested in that at one point? Is PNF stretching like what a bunch of different courses are based on? Like, is that still popular?
Which Ty are you talking to?
You're Ty. You.
Ooh, I'm the Ty. So yeah, there's actually a lot of courses, and a lot of people believe. So a few people that I learned from, they were saying that PNF stretching is pretty much one of the best stretches you can do, because it kind of involves the patient in an active way rather than relying too much on the passive. It is a pretty interesting one. It's used really, really commonly in sports injuries and stuff like that, because the athlete is going to be pretty athletic, of course. So you want to actually use their muscles to your advantage. For example, if you want someone to get a better hamstring stretch, you could get them to actively try to bring their legs toward their chest and contract the hip flexors and the rectus femoris to try to stretch the hamstring even more with neuromuscular facilitation. Am I saying that right?
Yep.
Right, Ty?
Yeah.
So if reciprocal inhibition, that's what I'm looking for actually.
There you
When
go.
you turn on one muscle, you have to turn off the opposite muscle, so your brain has to do it for you. So it's an interesting one for sure. But yeah, it's a lot of courses would use that if they aren't just fully PNF stretching course for sure.
Okay.
Yeah.
That just reminded me of that. But I actually, before we get into the next question, I did have a question for you, Morrow, where it just came up here when you were going over mobility. You know, when you said good and bad mobility, and maybe this is something we could go into a little bit more in the future here, but like, do you think that instead of using I think we all here understand the issues with saying something is good or bad just in general, and especially without context. So good or bad mobility is kind of something we might roll our eyes at, but like, do you think a better term for that or a better way to describe that would be like, and maybe you guys have ways that you like to describe that, but like high or low mobility? You know what I mean? Like someone who's hypermobile and then someone who's not, like, is there just better ways to describe that that's without context?
I'll try to tackle that one a bit,
Sure.
Tim.
Yeah.
So one thing I wrote down was basically like when to stretch or
Okay.
like why, right? In terms of mobility, in terms of anything, like you said, nothing's really good or bad because it all depends on what context you put it in. But really in terms of, I think, like stretching or like looking at improving range of motion, you have to look at what are your treatment goals and what are the athletic demands, right? So in terms of mobility, if you're a power lifter versus a gymnast or a yoga instructor, those goals are going to be a lot different. So in terms of how you stretch, to what range of motion you're pushing for, it's all going to be dependent on, again, why you need that mobility and then what you're using it for.
So it still comes down to the context, which makes sense. Yeah. Because like
I could
ultimately
touch on that a little bit too.
Sure, go for it, Matt. Like I was just going to say, like with the good and the bad, you would have to answer context, because good or bad implies that there's good and bad for something. So like if I just like grabbed Matt's shoulder, lifted it up over his head, and I'm like, wow, you have good mobility. And he should look at me and be like, good for what? You know, like that would be the right follow-up question. Be like, good for what? Like, what do you mean? You know?
Don't
like,
have frozen
just like,
shoulder then.
yeah. Sorry, go for it, Matt.
Yeah, I was just going to say I completely agree with Kyle, and needing to meet a certain demand, and how like my switch in the last little bit from powerlifting and my initial background to now being a pretty consistent Olympic weightlifter, how the quote unquote mobility demands are so much different in regards to like having to have good overhead mobility to catch a snatch in the bottom of an overhead squat, versus I didn't need the same quote unquote mobility for squat, bench, and dead. Like it's completely different, changes, whether you need certain stretches, what you need to do, yada yada. But definitely depends on the demand.
And you probably don't want that mobility necessarily as a power lifter.
No, I didn't. I never stretched, never worked on owning certain end ranges of motion. Like I didn't really do what I now kind of do. So
yeah. I still remember, even personally too, like when I was doing a lot more ollie lifting stuff and different variations associated with those lifts. Like even comparing the stuff that I can do now, as far as like what I know is my own ranges of mobility for, say, my shoulders or even my hips, actually. Like even warming up with the empty bar and a low bar squat with no shoes is tough for me to hit depth. Now I have no problem with that, but it just is what it is. And I'm not like surprised by it because I don't train that. But I remember when I was doing like catching cleans in the bottom or doing a lot more overhead stuff. You know what a SOTS press is, where you're in the bottom of a squat and you press.
Oh yeah.
Like it's crazy the mobility you need for that, right? As far as the hips and the shoulder joint simultaneously. And I could do all that stuff, and I don't really want to do it right now, so I'm okay with not doing it. But it's just funny that like I can totally see the difference. Like you neglect it, or not neglect it, it's not even a good word, but like you don't work on it, you don't have it. And if you work on it, you can get it. But, I totally stopped training those patterns, and then I lost those ranges. So it's like, it is what it is. But
It's also based on the demand. So like I was going to outline mobility versus stability and why they're pretty much the same when you need stability. If you don't have stability, you'll have, let's say you have hypermobility. That's not great. You'll probably be pretty prone to injury. But some people don't have the mobility because they don't have the stability, right? If your muscles and joints aren't okay with like having something above your head, you're probably not going to have your hands above your head all the time. So in order to gain mobility, I think stability is one of the best things. And we can kind of go through that a little bit more going forward. But I think it's a good use of your time to be able to just train those ranges rather than, trying to stretch for too long and gain mobility. I think you'll gain it by doing like the more stability and just doing that thing. Like you want to get better at squatting, squat. Pretty simple idea.
Morrow, did you have thoughts on that?
Yeah, I think like something for me, even like with like assessing like mobility and like with demands would be body weight even versus loaded. Something that I think often gets underlooked. Like when you say like you're doing an assessment on someone, you're having them do an overhead squat with a dowel, body weight, whatever. In the end, like what context does that provide for you, right? So I know that's been like a requirement in the past at like gyms that I've worked at, where you kind of like that's what you do, that's your assessment. But in the end, like you're trying to improve athletic performance, and like how often is like a hockey player going to be doing that, right? So it's more effective to kind of see like put them in a squat, but in the end you're just training a squat too. Where it kind of gets like into the nuances of like, okay, mobility under load versus mobility not under load. So like you can get on into a nuanced discussion about stability, which is like almost like another completely different topic, right? Where like, are you creating like those co-contractions to stabilize the joints? Are you kind of creating like that joint centration that you're kind of looking for from the joints that are completing the movements and stuff as well?
Nice.
Sure.
So I guess I was the one who took us down that rabbit hole. Sorry, guys. Okay, back on
It's
it.
okay. That was a fun one.
Yeah, no, that was good. Ty, I'm gonna throw this one at you.
Sweet.
The stretching one. What? Tell everybody what is happening when you stretch. Which I think this is a very important one because I don't think anyone knows this. Not anyone. I mean, a lot of people we talk to in our circles know this. But I think when people say they're stretching, they don't really know what they're doing. I think they literally. I think they think they're plying apart tissues that, like I stretch my hamstrings. Now they're longer. I have longer hamstrings,
Yeah.
So maybe if you could explain people a little bit more detailed what's happening there.
Sweet. I'll try to keep it as kind of layman's as possible, but I have to use a few kind of fancy terminology. So when we look at the structure of muscles, obviously the end of muscles is called a tendon, and that tendon attaches to the bone. Right. So you have two tendons contracting, it contracts the muscle and it moves one bone towards the next one. Right. So when you look at the Golgi tendon organ, that actually elicits the stretch response in muscles. So it is actually telling your muscle to like contract or stretch or, protect you from stretching too much. Let's say if someone like push you from behind, your head goes backwards, the muscles in the front of your neck, the Golgi tendon organs will be stimulated to pull you forward so your neck doesn't break and your head doesn't fly off. Right. So what's happening is that the Golgi tendon organ is telling the sarcomeres, which are your muscle fibers, to relax, right? If you're doing something and the body doesn't deem it dangerous, it'll let you. So hence why it takes a little bit to get into a stretch. Hence why the first like 15 seconds they say isn't like an effective stretch, because you haven't really like given the chance for the Golgi tendon organ to let that stretch happen. So that's why it's usually typically what Ty was saying before, where it's like 30 seconds to, anywhere up to 2 minutes, right? So you're essentially just like moving the muscle through its entire range of motion, but it makes a short change of range of motion, a short increase, because you kind of, I'll make this kind of very simple, for lack of better words, you're turning off the Golgi tendon organ response. So it'll allow all the sarcomeres to lengthen longer, right, through its range of motion that it is able to do anyways. Like you're not lengthening something to a point where like it's now going to stay at that point. It was already able to lengthen there. It just never needed to. So the Golgi tendon organ is like, well, we're going to take it easy because we don't ever do this. So that's why it kind of hurts when you stretch, right? Because you just don't use that range of motion ever, or you just don't use it enough for the body to go, oh yeah, that motion is not dangerous, right? So the brain and body does everything in response to you not getting hurt. That's pretty much it. The brain is all about self-preservation. So that kind of went down the rabbit hole about talking about what stretching really is, but that's kind of the best way I could put it. And what really, like, one of the best theories that I know of is called diffuse noxious inhibitory control. And it's the thought that if something is hurting, so if you stretch a muscle, all parts of it are going to stretch, and you're probably stretching other things, other soft tissues, other muscles. The brain actually thinks about all those muscles, right? So it actually like diffuses all like the painful stimulus over a bunch of different things. So you're not thinking about the one structure that you're trying to stretch, because you're never just stretching one muscle if one muscle, let's say, is hurting. So again, the brain will actually, like, it's called descending modulation, neuromodulation, where the brain actually goes, oh, we clearly need to stretch and other things are happening. So we need to pay attention to all those other things. So that's why a stretch feels good. So after, you don't really feel that area you were stretching before, because the brain kind of turned it, well, the Golgi tendon organs, let's say, are a little bit turned off. So they're not like give as many signals to the brain. And then you're not really feeling it because you've stretched a bunch of other muscles as well. It's kind of the same idea of like, if your leg really hurts and you punch yourself in the face, you only feel your face for a while. So that's kind of how stretching works, but it doesn't actually make any long-term changes to the muscle or tissue or anything like that, because we are ridiculously strong creatures. So if you think you can pull things apart by stretching, you're not. You quite literally wouldn't have enough force. And if you did, you would tear stuff, and you would never go that far, because again, your brain's really good at self-preservation. Someone else would pretty much have to do that to you, if that makes sense. That's pretty much
what you were describing before, as far as the diffuse noxious inhibitory control thing or whatever, that whole theory, like, is that like, I've never heard stretching described in that way, as far as like what it sounded to me like is it has an analgesic effect potentially.
Yeah.
Is that true?
Yeah.
Like, I've never heard of oh, sorry, go ahead.
No, I was going to say, because even if I can relate this to massage or chiropractic, right? If you push hard enough on something, some people like that and they go, yeah, like, that's amazing. That's the spot. Please press harder, because they think it's pressing something out, some fluid, or pushing the knot, or untying a knot, or whatever the person presents with. You are pressing hard enough that the brain goes, oh, geez, this isn't great. So it'll give you some of the hormones that are responsible for analgesia, for that pain relief. So the body goes, that hurts really bad. Here's some things that make you feel better. Here's some drugs. So that's why something like a massage feels really good, or someone to stretch you really hard feels really good, because the brain dopes you up. Right.
Yeah.
So that's why stretching feels really good.
Yeah.
And people do relate this ability to go farther and have more flexibility, quote unquote, whatever it is. They deem that in like oh, my muscles aren't tight, they must be healthy. So that's kind of why people do it, right? So not to say that it's silly when you hear it like this, of course, but like when someone tells you, I like stretching, it makes you feel good, I'm always like, yeah, makes sense. Like, I see why you feel good. But again, by that logic, like, punching yourself in the face would make the rest of your body feel pretty damn good, right? So
how dare you take it to logic's end?
I know. Sorry about that, guys.
Have you ever done that?
Punch myself in the face?
Or punch a client?
Whoa,
no,
easy now.
No. I mean, we can go there if you want, but
only when they didn't do their burpees. No, I haven't punched myself in the face. Only others. Wait, what?
Good.
Allegedly.
I used to like when I've got a headache a couple times, and you just like, you kind of hit your legs, you're like annoyed with your head, you're like, God, and you like hit yourself in the leg or something, and then I'm like, actually, it's kind of nice, because I don't care if my leg hurts. but I'm more scared if my brain hurts. But I've never punched myself in the face because this
Punch
is literally,
myself in the leg to protect my
That's
head.
the moneymaker right
Yeah.
there, man.
this is
You
pretty
can't-
much
you
all I
can't-
have going for me. So I, don't really want to affect it very much.
That's fair.
I
Morrow,
know.
do you have some thoughts on that?
Yeah, like I think you covered some good points. I think the trend is generally that stretching is more of a sensitization adaptation rather than an extensibility. So you kind of talked about like making muscles feel longer, making them feel less tight. What it really is kind of like the idea of like habituation, right? So you get used to your muscles kind of being in those ranges of motion that you're not commonly in. Like one kind of topic like that, like people come in for is like, oh, I have bad posture, I have rounded shoulders. Like as I'm sitting with my rounded shoulders here right now, that's not like necessarily bad, but it does feel weird sometimes when you're sitting upright, especially when you're kind of in like a mode and you're just like on a computer for long periods of time. And that's a posture that you kind of adapt to. Now that's neither good nor bad, but a lot of people say, oh, this feels weird when I do straighten my shoulders. Well, you can kind of like increase that through like habituation and make it feel less weird and make it feel a little bit more comfortable. And then again, it's like kind of like it's more of a sensation, right? So it's like those descending processes that you kind of touched on, which is generally where kind of like where things are trending in terms of the research and the discussions that are surrounding stretching currently.
I have a specific question for you guys. Actually, maybe you guys were already going to touch on it. I think a few of you probably were. Does stretching decrease injury risk?
Ooh,
Go.
who wants to start?
Ooh.
So I can take it right off the bat there. There has been multiple studies that have shown, there's actually a few that show that it did decrease injury risk, and it was army, it was military men, and it was like younger military men, and they stretched hamstrings and they found a 5% reduction in injury. But it was like this weird, like it reduced back injuries by 5%. And it was like, well, how did you know? Again, injuries might just happen. So it was weird how they calculated. So like no one actually takes that study. It used to be a big one, but no one really takes it at face value anymore because it just doesn't matter. And that's not statistically significant anyways. But every other study you pretty much look at, and if anyone ever wants to see them, I'll send you them. It actually decreases performance. So again, when you stretch a muscle to its end range, again, with that like the Golgi tendon organ has to like turn off in order for you to get to that new range of motion that you're clearly wanting, because your brain's like, hey, you've been holding this for a minute, I guess I'll let you do it. So now your muscles are actually like less capable of contracting. And to stop yourself from injury, your body will contract muscles to hold you in like a position without tearing ligaments, breaking bones, all that sort of idea. Your muscles are holding you. So to stretch them out before would actually, and it's only a few percent. Like out of all the studies that I've seen, I've never seen it like, 100% of people that stretch get injured, but it's like a few percent of a performance decrease, so an actual maximum strength decrease. So you actually decrease your strength advantage and you decrease your stretch response, your stretch reflex. So if someone tries to stretch you really fast, your muscles would reflex and stop you from stretching. So, you couldn't ever really make a stand to be like, you need to stretch, it'll decrease injury risk. Because essentially it's the opposite, because it's making you less, it's decreasing your performance.
I'm not sure about like I haven't read any studies on the risk of injury, but I do know for a fact, Tyler, that there are some studies out there that show like longer static stretches will decrease like maximal strength output.
Yeah.
So from what I've read on stretching in general, it's usually kind of like short stretching or dynamic stretching to kind of, warm the muscles up to be able to, get the range of motion to be able to perform your exercises. And then in terms of if you're looking at improving range of motion or mobility further, to do those longer stretching afterwards so that you're not decreasing your strength output during your workout.
Definitely. And I couldn't agree more with if everyone ever has ask me about stretching, I'll say, and if they really enjoy it, I go dynamic before, because it just kind of, like you said, it kind of warms you up, Kyle, and then after you can static stretch if you like, but again, you really just kind of, it's just the relaxation that you're going to enjoy, not the actual like benefits of those stretching. It's just the fact that you're doing something for yourself, and you're, when you're stretching, you're probably laying down. Like I'm sure we've all seen people at the gym just stretching, laying down, stretching after a workout, which I think is fine. I don't really think it does much other than
a nice cool down.
Yeah, it just makes you feel better.
Social time.
Exactly. I got a kind of a quick question for you guys. I'm trying to phrase it in a way. When people say you got to warm your muscles up, you got to get the blood flowing. My first thought goes, well, if your blood's not flowing, you got a bigger problem. Like all your tissues have blood in it. Like that's how you stay alive. And I think you're going to be okay. But do you guys think a warm up is necessary? Really? Like a warm up in like regards to like static stretching, and let's say it's not specific static stretching, you're just like swinging your leg and swinging your arms around and stuff. Do you think it's necessary to warm up necessarily?
I'll field this one.
Definitely not.
I'll touch on my own experience, for example. So I will do a bit of a dynamic warm up before every workout that I do. In my garage, I'll hold the side of my squat rack, get into a deep squat, shift around in there for a little bit. I'll use some plates and do some front foot elevated split squats, like trying to own certain ranges. I'll do some dynamic leg swings, B skips, yada, yada, whatever you want. Like I'll go through a little 10 to 15 minute routine. And I do notice that my temperature goes up. I feel good. I mentally feel ready for my session.
Sure.
So there's some mental clarity there. Listen to some music, get pumped up. My body feels better than when I first stepped in the garage. But only when I do dynamic stuff. I have not found any benefit, like you guys just touched on static stretching pre-workout, doing anything beneficial for me or any of my clients in what I do for a living as well.
True. That's a good point. I like that you said the subjective. You just feel better. And you can't take that away from anybody. I think that's awesome. Right.
And I think that's an underrated part about performance too. That is not everything, but at least worthy of consideration is like, do you feel better? Cool. It's the whole idea. Like we all played sports, right? It was the whole look good, feel good, play good. It's like we all made fun of the guy who had, I don't know, who played football here, but they had like 79 different armbands, and it's like, well, that guy looked good, felt good, may or may not have played good, but it's like, it matters, So,
yeah.
So I think like at least any ways that you can, I guess that's also why like athletes have pre-game rituals and stuff, because those are obviously silly. Like obviously we don't have to discuss that. There's no science there. It's silly, but it doesn't matter. It's the fact that it gets them into the right headspace, As far as like a warm up, I think you were going to say something there, Kyle, but just like, I'll just touch on the warm up thing quick. Is like, with your question, Ty, I think a warm up you have to define warm up. So warm up, let's just quickly define it. You're warming your body up. Literally, that's just how I'm going to define it. You're literally just increasing body temperature. If that's all it is, then I think a non-specific warm up is fine. I don't think it's that big of a deal. That being said, I think if you wanted to add on to that and improve onto that, which I think most people who care about their performance do, then it's like, okay, well, how do I increase my body temperature, warm up, as well as couple that with specific exercises that I'm going to be doing during that session. So like even I've started to increase I've noticed personally, I haven't done powerlifting singles on any of my lifts in like a year and a half or 2 years until I started recently again. And I noticed that, and I'm not even very strong, but it takes me a long time to get up to my single intentionally. Cause I notice I'm stronger once I gotta be sweating a bit. I gotta have my heart rate up. I actually need almost like, I feel like it actually takes me a little bit longer to get that like neural excitability or whatever, like just to get like anybody knows, you squat 135 and it feels like it's barely moving, and then you squat 300 pounds for a single and it moves the same, and it's like, but it takes me like 12 singles to get there. Maybe it didn't need to, but what I've noticed is that I'll take my time now. I notice that if I rush, I notice my performance isn't great. And I think it's a lack of warming up and lack of, maybe it's not even physiological. Maybe it's actually part of it's mental too, or the act of rushing also. So while getting myself to like slow down, give myself the time, allow myself to do, okay, whatever, say I underload and I have to do an extra single. What's wrong with that? Extra volume, extra practice, it's only positive. It eats up more time. I guess that's the main thing, right? It just eats up time as a resource. So if I can afford that, then why not? That makes sense for me. But I have noticed that I think the fact that I need that many singles maybe potentially indicates that actually I would benefit from an extended warm-up of some kind. Those are my thoughts.
In terms of like your powerlifting example, Tim, I think there's definitely some benefit to warming up, because you're essentially just like priming the nervous system too. I mean, the warm up, it makes sense. Again, increasing body temperature, potentially increasing the elasticity of like the muscles or fascia, something like that. You're shunting blood to the skeletal muscles. The warm up makes sense, but then on the nervous system side and also hormonal side, building up to those singles, it just makes sense. This is what all the best lifters in the world do. You start slow and slowly build up weight in singles to release those stress hormones. Psychologically get yourself psyched to do those lifts. It's most likely a whole body and mind
totally
kind of concept to increasing maximal strength output.
Right.
That's where you can add punching yourself in the face to also get yourself there, right?
True. I like the circle back time. I appreciate that.
Yeah, good callback. But yeah, that's true. I think the warm up does a good warm up would incorporate the mental and physical together. Even as I was kind of saying my bit there, it kind of that became obvious, I think. But I do think a warm up is important. Now, I will say that like personally with my clients, most of them I don't do an extended warm up. I use a warm up in the most general sense, where it's used to increase their heart rate. And I have ways of doing that I like. And then depending on the client and also their mental state on that day, they may need a little bit more. So that's kind of I just play that by ear. Other than that, I have my default, it takes 5, 6, 7 minutes, whatever it is. And then away they go. They're warm. There's no break on a warm up. The whole point is warming up. You're trying to increase your body temperature. Why would you take a break? You're not trying to decrease your body, right? You're not trying to cool down yet. So just get moving. If you're moving straight for 7 minutes, regardless of what it is, you're probably going to warm up, So, yeah. So I put a lot of focus. I think a lot of people in the stretching conversation, or stretching and warm up conversation, it's like I know I didn't really say anything specific to stretching, but as far as warming up, it's like they'll talk about, whether you need one or not, and I think, and specifically what they are, but I think what can definitely be said is that a warm-up obviously has to be a part of a workout program of any kind. Like you're going to have to warm up some kind at some level. You can't go in cold to anything. So, were you going to say something, Matt?
Well, I was just going to say that I'm the same way, like with all my clients. If any of them are listening to this, they know that I'm a big fan of the Stairmaster or an incline treadmill walk, 5-7 minutes, like you just said.
Yeah,
get the heart rate up, get warm. They hate me for it, but that's how we elevate it. So it's good.
Nice, man. Yeah. See, and then like I would do something similar, or at least elicits a similar response, and then depending on what the session calls for, move into a warm up on those movements. Yep, so that's kind of how I would do it. Is like, okay, you got the body temperature up. Now let's implement some specificity. So now it's like, okay, they're moving into a bench press. Well, some type of pushing or just warm up with the empty bar, and then they're good to go.
So I think it's worth pointing out right now, like we're a little bit off the stretching topic for like specifically, but we're into warm-ups, and typically people use stretching as a warm-up if we're going to view it right now like that. None of us said like static stretching, right? And I had points, and so did Kyle, and so did Matt, against using static stretching right before some sort of activity. So if someone's looking for a takeaway from all this so far, is that like, yes, warm up. It doesn't have to be specific. It can be as specific as you want. So for Matt's example, it feels good to get down into that squat and kind of move around and figure out that range of motion and feel warm in the movement you're about to do. So it can be specific. It can be general, like walking on a treadmill, all that stuff. So honestly, I think I would die on the hill of like, I don't think you should static stretch before any event, any workout, any sport, any whatever.
Unless your event is static stretching.
Unless your event is yoga, then nail it every time.
Yeah, yoga's kind of like that, right?
Yeah.
Yeah.
Yoga champion.
Championships.
Yeah, I think just to summarize again, Tyler, I think that from what everyone's saying is that static stretching hasn't really created any lasting results in the literature anyway. And it's more, I think a couple of you've said it too, that it's more of the active stretching, right? The active stretching or just the active exercising into those ranges, right? Are creating and developing that motor control, those motor patternings to create more lasting results, to teach the brain and the muscle that it's okay to go in these ranges and to keep using it, right? I mean, I think
Exactly.
that the best, I was thinking about this earlier, is one of the best ways to, if someone's coming in and they say, it feels awkward or I'm stiff, I can't get down in a deep squat, spend more time in that deep squat, right? Just spending more time using those ranges, being comfortable in those ranges. That's the best way that your joints, your muscles, and your nervous system are going to get used to that range.
And you know what? You know how you can, Tyler Paterson, I've said that like ad nauseum, but you know how you could prove that to anyone is unless someone has, barring something, some type of specific condition or injury that they have, it's like anyone who can sit will sit, and then they can sit in that 90-degree hip flexion. Like they can always they never lose that hip flexion. Like that's always there if they can sit, because they sit. Like they spend time sitting. So it's like your hips are able to at least come up to 90 or however much you sit. So it's like, it just goes to show, it's like you may lose everything outside of that. You might not be able to bring your knee up any higher, but you can do it enough that you can sit on a couch or a chair or whatever.
Yeah. Well, and you can just see there's cultural differences too in different parts of the world where it's normal to squat and stay in that squat to perform tasks, chores, hobbies. There's other parts of the world where there's not chairs everywhere in every single room, where people have a lot greater hip flexion, knee flexion, ankle dorsiflexion. And it's just, or you look at a child, right? Before they've gone to school, for 10 years and sat in a chair all day, we come right out of the womb with a great squat, right? No one needs to teach us, no one needs to train us. We just squat naturally, and it's perfect. But because we sit, because we spend so much time in a seated position, we're not groomed, we're not trained to stay in a squatted position.
Yeah, and that goes to that kind of touches on as well the implications of why the argument that, I'm getting old, so my flexibility or mobility sucks, or whatever word you want to use, or whatever they're talking about. It's like, it's not your age that's directly causing that. It's your lack of activity as you get older that causes that, or the lack of variation of positions you get into anymore. Because you probably got into all the positions, when you're 8 years old, you're doing everything. You're flying off trees, jumping up and down, doing cartwheels, whatever.
Not enough exposure to the ranges.
Yeah. Decreased exposure. I mean, it's like it's standing, walking, and sitting and lying down. Like,
Do you guys see
that movement variability, right?
Yeah.
Hey Tim, do you guys see my 10-minute squat today that I did?
Yeah, I saw your time lapse.
Similar to what Kyle was just saying about how some people can just sit in that position. So I tried to own it for 10 minutes today, and that was awful. So I
And you
tip
were
my hat to anyone
using
that can.
and you're using help too, right? Weren't you holding the?
Yeah, I was trying to hold the side of my squat rack just to like keep
Yeah,
myself more upright because I
totally.
did it last week without holding that, and I
Yeah.
wasn't happy with the posture that I was expressing. So I was just holding on to the barbell or the squat rack just to
And
own
dude,
it.
Sorry, was this just body weight? Just was it loaded?
Yeah, just body weight. Yeah, just a 10-minute squat test just to
Awesome.
work on the ankles, work on the hips.
dude, as far as in like Olympic lifting stuff too, like that stuff will serve you big time.
Yeah, exactly. That's why I do it on my rest days
Big
to
time.
own those positions so that when I go under a barbell tomorrow, I feel a lot better.
Do you do anything similar in your warm-ups at all?
Yeah, I'll do that same squat, just not for as long.
Okay.
And
Yeah.
I'll do a bit of thoracic rotation, different things just to
Yeah.
kind of open up.
Okay. Okay.
I'm gonna put
go
my
ahead, Tim.
moderator hat on, Tim, if you're okay with that for a sec here.
Go ahead. You can take it.
So I kind of want to. Oh, thank you. I kind of want to switch gears a tiny bit, and I'm glad this is on video. I
Watch
want to
it when
switch
you're
gears a
done,
tiny bit,
you
and
filthy animal.
I know, damn it. This is gonna obviously me, Ty, and Kyle can really get into this, but you and Matt, Tim, could definitely weigh in, no problem, on this question. I want to talk about stretching in regards to like an actual injury, like someone is hurting and like stretching in pain, basically. So, someone comes into my office and they go, "Hey, this feels tight," right? I try stretching it and nothing works, and it doesn't work. I hear that all the time, all day long, basically, because I'll ask, like, "Well, does it help?" And they go, "I don't know. Someone told me to do it. It doesn't really help." And I'm like, "Cool." So right there, I go, "Sweet. We don't have to stretch at all because you clearly don't like it. And it obviously hasn't done anything for you, so we're going to switch it up." And I get to like load their tissues and make them work out, so it's just a win-win for me as well. But I'll ask this right to Kyle right now. In your practice, Kyle, do you use a lot of stretching? And like, it kind of goes to the next question that we were going to cover anyways. Like, when is stretching a good idea? Can you think about some like clinical experiences why stretching would be a good idea?
So, say it's a patient, they want to be able to reach down and pick something off the ground. And, just if I say, "Hey, do this static stretch, sit on the ground and try to touch your toes." And that's it, that might not be helpful. But if I do maybe some PNF stretching, getting them to be more active, and warming up the hamstrings, and then getting them to do a straight leg deadlift, or start to then use that stretch to then get them to do the movement afterwards and use those ranges. That's more of what I would use it for. In terms of managing an injury, I mean, a lot of muscle strains, right? You're managing it through progressive overload of the tissue. So that can be done in the form of, if it's the hamstrings, you give them 2 dumbbells and you say, "Okay, do a straight leg deadlift, or do like a Nordic, hamstring isometric hold, or could be doing a PNF stretch where they're contracting, you're pushing a little farther, they're contracting, you're putting force through that, and then gradually, or you're doing like an ART, soft tissue pass, active release pass of the muscle. You're just progressively putting force through the tissue so that it's able to regenerate and repair in proper orientation in terms of the muscle fibers, and to gradually strengthen that tissue. And whether it's muscle, bone, whatever, eventually you got to start just gradually putting force through it so that it remodels and adapts to that stress.
Yeah, funny. That's actually one I had written that down to talk about too, because I learned in school that as well. And I want to do more of a dive into it, but you want to realign the tissues properly. So following an injury, you tear a muscle, let's say, scar tissue is just kind of thrown there really rapidly and not organized at all. So I wonder if it's more efficient, because I'm always trying to find the most efficient way. So the quicker we can heal something, or the quicker we can realign something, I think it's better, or the more efficient way. So like with stretching that tissue and holding it in a static stretch and trying to like realign those tissues properly while it's healing, is that better than like loading the tissue? Because with your examples, Kyle, and the reason why I do the same thing as you, so I'll go, rather than me stretching it for you, if let's say static, because I do like PNF, but I'm like, let's do some RDLs, throw a couple of dumbbells in their hands. So it's the same thing. Now they're using their body weight and maybe a little bit extra weight that you can gradually do that, rather than PNF where like, I don't know, some days I feel stronger than others and some days I'll push their leg like really far. So you can't really like judge how much tissue tolerance that they have right now. So, you know, even when I look at that, when someone goes, well, stretching is good for scar tissue realignment, and I'm like, exercise is still better for it. Like, I just can't, unless one of you guys have a reason why like static stretching would be better. Go ahead,
I'll
Ty.
pop in on that. So I think it depends a lot where like the client's at. Like for me, like just personally, like it's personal anecdote, but like I've got like pretty traumatic like scar tissue like in and around like some sensitive areas. You can kind of see it on camera. And for me, a lot of when I started to exercise again, associated with like fear avoidance behavior. Right. So I was scared to move. And I think stretching was massive. So in the end, like you have to meet the client where they're at. Right. So a lot like what we've been talking about is load is obviously optimal. You want to be able to get a patient or a client to the point where you can load them. It's going to be better than a static stretch. Obviously, PNF can be used in there. The faster you can get them to load, as you kind of mentioned, is ideal. But still, you got to meet that patient where they're at. Like Kyle, you used the example of getting someone to bend over and pick something off the ground. A little bit of a common narrative out there is like, oh, don't flex your spine, right? So that's kind of been floating around out there for, I don't know, a couple decades now, probably. But in the end, it's not don't flex your spine, but just more so be mindful about the load that you're kind of carrying when you're like going down to pick something up. And I think that needs to be had with needs to just be a discussion with the patient or client that you're kind of dealing with. So like biggest thing, kind of meet them where they're at, and like say they come in and say, oh, I've tried these stretches, they're not working. Well, then you introduce some variability. You kind of explore the different ranges of motion that they're not used to. Maybe you apply load, maybe you take away load, you use bands, you use barbell, which is like the best method, I think. But you have to get them to that point, right? So just from my personal experience, I've been in that position where I have been fearful of movement, just because there was a lot of unknowns in terms of what my situation entailed. And I found stretching like as a huge benefit, and like ART and like all those like different methods, like more passive therapies, as you would say. Like in the end, like there's a time and place to implement those, but ultimately end goal from like especially our bias is load it.
Wow, dude, well said. That was amazing.
Ty, what was your original question? I'm trying to think.
My original question was, oh God,
Is
It was going to tie into why it's a good idea, but
or I think you're talking about like, is stretching like better or worse compared to like actively loading the tissue, like when to use which, right? And
yeah, okay.
like Tyler was saying, I mean, again, as long as you're taking patient preference, with every patient I always ask, what makes it worse, what makes it better, okay, what stretches have you tried, okay, and did that relieve it? Yeah, it's feeling better. Okay, well, we're going to continue to do the stuff that makes it feel better.
Nice.
Right? I mean, at the end of the day, you're whether the patient's ready to do a straight leg deadlift or slowly start progressing into just like a straight leg raise stretch. It's all again dependent on context.
Yeah.
Well, sorry, go ahead.
One more thing on that. What's kind of cool is there is a little bit, there's not much, but there's a little bit of literature out there showing that you can actually induce hypertrophy via stretching. So, which is something we all strive for here. The bigger, the better, right? So, so in the end, like depending on how conditioned or deconditioned your client or patient is, you can hold a stretch, and maybe that 10-second stretch is like majorly beneficial for them, right? Like that's a very rare like incidence, I would say. Like not all the time you're gonna come across that, but there are some scenarios where you
the muscles probably just it's like a natural eccentric contraction when somebody is stretching it, right? So it makes sense that eccentric contraction creates hypertrophy.
And like I don't know in the studies what you're talking about, Morrow, whether like how they measured that and stuff, but I wonder if it also had to do with just the fact that if the stretching was next to a hypertrophy resistance training program, then you kind of temporarily were able to make available more muscle fibers or more muscles to grow. So
yeah, well, unfortunately most of the studies are animal studies, but
jacked rats.
Yeah, which is like, yeah, you can take it with a grain of salt, but in the end, like muscle physiology is muscle physiology, and there's still a lot of similarities there, and you can kind of take those theories and they are applicable to humans, and I think there is like a little bit of stuff out there that do apply to humans, but it's hard to measure in terms of like histological studies and efficacy and stuff like that.
I think your guys' points on like as far as like the question from Ty originally is like the client preference is a big one, at least for me, because I see clients that I've had in the past where I look back and I see learning experiences where I didn't manage them. I managed them as well as I could have with the knowledge I had at that time, but looking back, I'm like, that's not how I would do it now, and I realize some of those the reasons why is like some of those clients, they wanted a certain thing and I thought that thing was wrong, and so I didn't let them have it ever. And I think that's wrong. Like I think it just goes into the need for nuance and context, because it's like some people, I think you need to give them some rope, and I think they need here's a good example, I guess. Like if someone's maybe emotionally a little bit more irritable and agitated and neurotic, like maybe someone like that with a number of whatever other issues that they're coming in with, it's like for you guys who are clinicians, like maybe dealing with someone like that, maybe telling them to grab dumbbells and get moving isn't the right choice at that point. It's like, is that really, like, that may exacerbate a problem. And I've seen like similar versions of that in my world, at least with personal training, where it's like, you know what, this person needed something that was a little bit more passive and a little bit more relaxed or slow, if that makes sense. It's almost like I jumped up too much. And while the end goal was to get them there anyway, but it's almost like I fast tracked them because I was like, oh, the process is pointless. No, that's not what I mean. It's like I fast tracked it and I didn't need to. There's a bunch of checkpoints there that were necessary and would have actually helped them along the way, I think. Kyle, you have a point?
Tim, I was just going to, I remember talking to you months ago about using the thumper. And for those of you that don't know, it's just a massaging device that some clinicians...
Wait, that kind of thumper?
Exactly. We'll use it to gently just massage the tissues before we work on them. But to your case in point, sometimes you need to, give the patient a bit, right? You do some of that passive treatment so that the rest of my treatment just goes smooth, right? I had many in my residency, many patients where, and I would try different things. I would, get them on the table, start doing some adjustments or exercise or this. But then the days where I did the thumper first, they were way more, responsive to the rest of the therapy. They needed a minute to lay down on the table, have someone place their hands on them or use a thumper just to decrease some of that muscle tension or that sympathetic drive, right? They just need, and the same thing can be used for stretching, right? You give them something that feels good, maybe has some little bit of analgesic response so that they have the willpower and the drive to go to the workout room now and perform those exercises that you're going to run them through.
You're building buy-in in a way too, right? Like you're getting them on board with what you're going to do. It's like, okay, maybe it sounds a little manipulative, but like you're buttering them up to like actually give them what they need, and priming them to be like, okay, this isn't necessarily what you need, but this is what you need to actually give you what you need. So it's all what you need, kind of, you know?
Yeah, this is what you need right now.
Exactly. Yeah, that's it.
You guys just talked about like, it's like a warm up basically. It's like warming up before working out. Like it's the same idea, right? Like regardless of kind of what it was, you need that like second to do it. But Matt, you were going to say something, eh?
Yeah, just kind of to go off what Tim and Kyle have just said, I wanted to bring in my fascial stretch therapy kind of experience.
That was
in
going to be my
regards
question,
to,
actually.
Yeah, I want to tie it into what they just said about kind of meeting the client where they're at, giving them a bit of the rope, and creating that buy-in. And I try to pride myself on being a trainer that makes someone feel a hell of a lot better when they leave the gym after being with me than they did when they came in. So if I can sense that a client's irritable, you know, just having a rough day, like Tim said, why would you go get them to grab a pair of dumbbells if they're maybe not ready for that yet? Right. So putting them on the massage table, doing a little bit of fascial stretch therapy, you know, which has been shown to calm the parasympathetic nervous system a little bit, get someone just kind of mellowed out, and increasing their range of motion, and then going back and owning those positions with the exercises I was going to make them do anyways, can kind of exactly meet them where they're at. I've seen some really awesome range of motion improvements with fascial stretch therapy because it is just constant PNF the entire time. And I've seen some awesome range of motion increases, and I've seen people hop off the table so mellow and a lot less wound up than when they came in. And then I know, okay, we're ready to get to work. We're ready to get under a barbell or use some dumbbells and, you know, get that joint centration and like a lasting improvement in their movement and well-being. And, you know, at the end of the day, we want them to leave happy with our service. So that's also relevant. But I've seen that time and time again. And it's just a matter of using stretching and knowing your client, knowing where they're at, and going with the flow, in my opinion.
Yeah.
I've said this before in like probably 20 podcasts, and I'll say it again. FST is my favorite modality ever to get done on myself. You know, like
Nice.
all the things I talk about with static stretching and stretching, people assume that I just hate static stretching. I just go, no, like in the ways that it's used, I don't think it's actually the most efficient. And in some ways it's actually a tiny bit detrimental, but I love it. FST is like the best feeling in the world. And
Yeah.
you just feel
How about a
good. You just
stretch you,
feel
Kyle?
like light. Oh, Matt, please get your
It
hands
is
on
the
me, dude.
best.
Yeah, no, I wouldn't mind getting in on that, man.
Yeah,
Oh,
man.
we'll trade services, boys. Come to Motus, and we're all gonna.
Yeah.
Dr. Kyle's gonna crack us all. Tim's
FST
gonna
party.
stand there and like tickle his mustache or something. I don't know. And then Matt's
Yeah.
gonna stretch us all. Yeah, he's
I
gonna
want to
twirl his
stretch
mustache.
too. Jeez.
No, you can wait. You're last because you have nothing to offer. Okay.
Oh, damn. Okay.
Yeah. It's a beautiful service, and it's something I've seen a lot of positive from. I just, like I had said earlier in the podcast, and we all can, for the most part, agree that, you know, static stretching, dynamic, sweet. FST, because of what it encapsulates, it's a beautiful thing, both mentally and physically, because like fascia itself can hold on to a lot of things, right? Can hold on to a lot of tension, both mentally and physically, and being able to let that go sometimes allows someone to find a range that they didn't even know they had, which is pretty cool. And I've helped people treat injuries. I've helped people treat mental health issues with it. And I've gotten any client that's used it has really started to move a lot better. So
I think
Matt,
you raised some good. Sorry, go ahead, Ty.
Oh, I was just gonna say you actually said something I was gonna ask you. Do you have an example of like someone coming in with like an injury that you've helped them get through with the FST specifically? Like, can you think of anything that like?
yeah,
Go for it, yeah.
I think the two most common ones that I see, and I'm sure I'm not alone in this in our realms, is like anterior knee pain or lower back pain of various kinds. I've got a lot of clients who are very sedentary with commuting to work in Mississauga or whatever it is, and sitting at a desk job all day, sitting while they drive, yada yada. So treating those chronic aches and pains or knee injuries, or just pain in general. I haven't treated like, what's the word I'm looking for? like a specific traumatic injury per se. I've
Like an
treated
acute injury or anything.
yeah, like an acute,
Yeah.
like a, I don't know, something that's torn or whatever. But if there's these aches and pains that come along, I've treated those by stretching what needs to be stretched and strengthening what needs to be strengthened, because I think those are two relevant things that can go hand in hand with easing a chronic pain. From what I've found in my own data I've collected.
Nice.
So working through those kinds of things, obviously it takes a bit of time. It takes FST a couple times a week with proper strength training, proper recovery protocols, nutrition, all those things combined, which I try to help clients with as long as I stay in my lane. And I've noticed, I've seen significant movement increases, decreased pain, people coming in and seeing me a lot limber than they were before. And a lot of people just saying how happy they feel and they're not carrying this tension in their body all day long. So
Nice.
Yeah.
Dude, can't take that away from them at all. The subjective is like, it's the name of the game pretty much. Like, you know, as much as me and Kyle specifically right now, but like Tyler as well, as much as I can look at objective measures and want those to get better. If they're subjectively getting better, then that's fine by me. I love it. I celebrate it. Like, again, I do use stretching in practice, but I'm never like, this is what you like, this is going to fix you. It just feels great. Like when you're laying on your back and someone pulls your head and pushes your heel down, it feels amazing.
I've had some people cry getting up off the table because of the what's like, they feel lighter, they feel that pain is gone. And like, I've had people cry, I've had people lift me off the ground by giving me a hug. Like I've had some super rewarding things that I will never forget from stretching and the therapy that I provide. So
Kyle, have you had someone cry in your treatment room before? In a good way. In a good way.
Yeah. I've had someone cry in my treatment room in every sort of way. Some on the way in, some on the way out. You see it all and I've only been in practice 2 years, but you see it all because you're dealing with people, right? All this research, and we like to dive into the evidence, but like Matt was alluding to, you're treating people, and pain in itself can create a huge emotional burden, and when you help someone with that, creates can really change someone's life.
It's the reason why I'm still a massage therapist, because I've had multiple people cry and want to give me a huge hug after, and it just like to be able to do that with your hands is like the weirdest thing, or just by talking or whatever it is magical. It's the best feeling ever.
You're not thinking about retirement already, are you, Tyler?
No, I just, so I just felt like useless, for lack of better words, sometimes, that people are just like, well, thanks, feel good, see ya. And I'm like, it didn't feel as fulfilling. But then I had a couple people cry, and I was like, oh, this is amazing. I'm chasing that high at all times. And it like makes me strive harder for my patients and learn more. And so all that research that you just alluded to there, Kyle, that's for us. It's not for our patients. Our patients could care less. None of my patients care about research at all. And I relay research results in a, digestible manner. And they just want to know that you know your stuff. That's it. Most of my patients yeah. Most of my patients just come in and go, okay, go for it. You're the professional. And I go, sweet. I have a few questions, but then we just get after it.
Yeah, I think no one really cares about getting sat down and being told about pain science for a half hour, right? We do. We care about it.
Yeah. I think it's important to remember too. Matt kind of brought it up there. So did Kyle and Ty. It's like, I'm sure you guys have worked on your fair share of different people in athletics and stuff, but most of us, I think most of our demographics are just gen pop people who want to feel better. And I think that's where it's even coming back to the stretching, that's where it becomes important, because it's it's a different question whether it's okay, does stretching decrease? Here's a good, we don't have to go down the rabbit hole, but here's a good example is we've already kind of rejected the idea that static stretching could be a good idea pre-workout for most people in most situations. It's but what if someone feels good with it, or they feel better? What if there's context that would make that a reasonable choice, you know? And it's like, okay, for an elite level football player who's playing at the university level, maybe he's obsessed with performance, and it's like, yeah, maybe you should like not recommend that. But what about someone else, you know, who's not doing that, the not elite elite athlete, you know? I think like those are totally different goals. So I think like when it comes to like what's the best idea based on the evidence, isn't always what should guide you. I think sometimes people say that. I think it's almost like it should be that plus the context of the person in front of you, because it's like, especially with Gen Pop, like they're so different and so weird. It's like compared to like elite athletes, like you know, like there's I think it's totally different. The goals are totally different. Like your situations are so much weirder, and that's a good thing. It keeps it fun. I like training Gen Pop, but it's definitely my training management and my recommendations are totally different. You know, then sometimes they're directly in contradiction of the evidence that I know, that I'm aware of. And I'm like, right now it doesn't make sense. You know, this person doesn't need that. I know the evidence says it, but like right now it doesn't make sense. So I go against it. But,
I think that's great, right? Like again, it goes into like meeting them where they're at and like the time and place for it. And the way I kind of like look at the evidence is the narratives that you put with it, right?
Yeah.
And because like when a patient has those beliefs, you can kind of help guide them towards a place where if like it's kind of been like we kind of talked about like the nocebo, where it's like kind of like a negative connotation to whatever you're kind of talking about, then you can kind of change that, right?
Oh yeah, definitely. The one thing I wanted to touch on before we kind of sign off is, you know, kind of everything that we talked about until this point, I think inherently had our own different values in it, which a lot of them are rooted in client self-efficacy and wanting to see people improve themselves, ideally with more and more independence and autonomy on their own, which comes down to self-efficacy being important to us. And I think one of the most important questions I think we should try and tackle before we sign off is, I'll field it to all you guys and then we'll just kind of roundtable it, is like, does recommending stretching inherently decrease client self-efficacy? Now, before you guys take that, I think the important thing to say there is like, I think all five of us have a pretty balanced view on stretching, and a lot of it comes down to different contextual factors. But I think that's a great question, because at Motus Strength Health Club, like the self-efficacy is important. And it is a main value that we believe in. And I think if we were going to recommend something that was in direct contradiction to that, I think we should stop recommending that. So I think it's important that we explore this and make it very clear to ourselves and our listeners, is recommending stretching, particularly passive, I guess like any type of, you know, we've had this conversation before when it comes to like any other passive modality where it's like, stretching could be a form of that. It's like, is it just another tool that they need now to improve? It's like, okay, it's in the name of improvement, but is this something now that they need for the rest of their life? Or does it come down to the narrative you give them, right? We've had that conversation before too. So yeah, what do you guys think?
So I'll go quick, boys, because my knee-jerk reaction is to be like, if you give someone something they can do for themselves, that's increasing their self-efficacy. And I think by definition, I almost think you can't argue it, but it is, again, depending on contextual factors. So if that is not going to hurt them, of course, give it to them, right? And like you were just saying, Tim, it depends on the narrative you sell, right? So you'll decrease somebody's self-efficacy if you give them something that is based on like false, like it's going to be harmful for their potentially for their psychological well-being. So I think that would decrease it. So it is context dependent, but like knee-jerk, if you just gun to my head answer, no, doesn't decrease self-efficacy at all. I think it increases it.
Do you think it could?
Given what I was just saying, like, yeah, if you spin the narrative wrong, for sure. Yeah.
Okay.
Yeah. What about you?
So
guys?
how you deliver it is important.
100%.
And why you recommend it, like the
Yeah,
situation
you tell
in which
someone
you do.
like you're gonna stretch one muscle and they're never gonna have pain in some area. Like stretch your hamstrings, you'll never have back pain ever again. You just decreased the hell of their self-efficacy, and that's terrible. And you know SIBO them pretty intensely, anyways.
Yeah.
So it's bad. What about you guys? Ty, Cal, Matt?
I'll go. I think if it becomes this negative stressor in their life, and this like thing that isn't getting them any sort of better results, or becomes this daunting task that they have to do on their own on top of all the other stuff they have going on, then maybe that's negative. But like you said, Ty, if it can be something that'll help them for the rest of their lives and improve that buy-in, then why would you not, right?
For sure.
I think the more homework I can give a client and the more that they can have the ownership and this mutual relationship in getting to their goals and give them things to do and they own it and they're proud of it and they come in for their next session and tell me about all these cool things they did on their own that are helping with our program and their goals, then hell yeah.
Nice.
I agree.
Yeah, well said.
Morrow, what about you?
Yeah, kind of playing off what those guys like kind of, as we've mentioned and what we've talked about, right? Like I've been known to say stretching stupid. Like I like that's definitely come out of my mouth like multiple times, especially when I was younger and stuff like that. I'm definitely not someone that stretches a lot, but I do try to like have variability in my training and the training that I provide for clients, and just ensuring again goals and narrative that goes along with it, making sure that if someone thinks that they missed their stretches one day that they're going to be injured, like no,
Right.
like that's not the case, right? So yeah, maybe I'll start stretching tomorrow. I don't know, we'll see.
Well, I remember like, before we get to like Dr. Kyle there, it's like, I remember I used to, I don't know when it was. I think it was before you were there, Matt, at Good Life in Orangeville. And like, it was back when I was doing a lot more Ollie stuff and I was stretching at the end of every session. And I look back at that time with like extreme fondness. I really enjoyed it. I did like reclining hero a lot and I did it to the point that I could just relax in the bottom of reclining hero. And like I could never get anywhere close to that right now, understandably, unsurprisingly, but and when I did it, it was one of those things that did take a lot of extra time. But I do look at it in a sense of like, did that decrease my self-efficacy? Did it cost me unnecessary resources? I would say no and kind of yes on the second one. It's like I was willing to give up my time, so it doesn't matter. It cost me time, but I was okay with that. So it's like, okay, do it. And then I remember feeling great doing it. Like I just relaxed and I felt awesome. Instead of rushing out of the gym, going to the shower, it's like I knew I had 10, 15 minutes to go stretch, and specific stretches that I enjoyed. So, again, it's like, I don't do that right now and maybe I will again in the future, but it's not like I look back on that and I'm like, that was dumb. It's like, I look back on that and I, enjoyed it quite a bit. But yeah, what are your thoughts, Kyle?
I was going to say in practice, the amount of people that come in with some form of injury, and most have tried a stretch, right? There's very few people that have come in with mechanical, like muscle soreness and, have you tried anything to make it feel better? It's our innate, desire to kind of relieve pain. If your pec, we come across stretches just without even knowing it, right? People will, if my right side's tight, well, then I'll stretch the other way and open that up because it just feels good. So most people are going to be trying those stretches anyway. Again, just directing them and honing them into what to do and why to do it and keeping a good positive narrative. I don't think will if you do it the right way, I don't think it'll decrease self-efficacy. And a lot of the stuff that I do with patients, I know in school, we get really obsessed with learning these orthopedic tests and what's negative and what's positive, but really focusing on things, just simple things like, with low back pain. Well, does leaning forward make it feel better or does leaning back? Oh, you feel better in extension. Okay, well, we're going to stretch like this, and here's why, right? Like, so just kind of, you don't need to go too in depth, but explaining why they're doing it and what to do can have a huge impact in them continuing and not just continuing, but continuing in the right direction with stretching.
I like that. Those are all good points.
Sure. I say this, I was just thinking about one quick thing. I talk to my patients all the time about, I think a lot of people's pain or like places that feel tight are actually the muscles that are kind of stuck in an eccentric stretch. So for a quick example, because we're pretty forward humans, we kind of bend forward and our shoulders are rounded forward, our mid backs hurt. So those muscles are stretching eccentrically. So this is very, very general and not like, again, there's too many contextual factors to go over, but search up, if you don't know your anatomy, what muscle is hurt, like what muscle feels tight on you, and search up the anatomy and type that muscle into Google and go, what is the opposing muscle to blank? And then find a stretch for that muscle. So for example, when someone has like mid back pain, I'm like, it's probably not the worst idea to like hold onto a door frame and like kind of come through. So you'd be stretching the opposing muscles. So if they are going to do a stretch, and if someone wants to stretch, I'll stretch the opposing muscle group, and they usually go, wow, like it didn't even touch the area or stretch the area that feels tight or hurts, but I actually feel better. So that's a very
you're contracting the focused area.
You're shortening it because it's just been like begging to be shortened because it's been lengthened for so long. So again, that's like the most general thing I could think of. If I was going to give someone a stretch, it would be that. Give it a shot and see how it feels. Because anecdotally speaking, a lot of my patients are like, wow, I actually felt amazing. Like, and I didn't have to do anything to the muscle. And I go, yeah, so stop like destroying it with a lacrosse ball, please. And stop shoving it into the side of a door frame. All right, relax.
Similarly, that's like kind of along the same lines of personal experiences I've had with clients where I've had many people, as have you guys, I'm sure, where it's like their upper back, like same example you used, Ty, upper back, like mid traps and stuff, and rhomboids are all like weird, and they just subjectively feel tight back there and sensitive. And then I just like, I'm not treating their pain. I just get them to work out. But I specifically, I'm like, okay, we're going to like target the upper back, and they do a bunch of rows. And then, 2 weeks later, they're like, my back feels awesome. Not only is it not hurting, but it feels jacked. So kind of similar idea, I think, where it's like I was forcing it to contract, which it never was before. I never thought of it from that perspective, what you were saying though.
Yeah.
Nice.
Just a quick quip. Yeah. Nothing crazy.
Cool. You guys have any closing thoughts? Let's wrap this thing up.
There's something to be said for an act that feels good.
Definitely.
Right.
A little bit of hedonism.
Again,
baby.
we like to dive into the evidence, but sometimes just doing something that feels good will go a long way.
Totally agree.
Yeah. That's why everyone should get stretched by Matt, because it's the best thing in the world.
Absolutely.
Well, boys, thank you so much for coming on. I think this has been one of my favorite episodes. I talked myself out of saying stretching is stupid. So it's really good. Ty, go ahead.
One thing I want to touch on, stretching does not decrease DOMs as well.
True. Yes.
I think that's one thing, like kind of we touched on pain, but like
that's
DOMs,
a common one. Yeah.
It doesn't matter. I'm sorry to say, but
yeah.
Actually,
Right.
I found evidence, Ty. I was reading this article today, rereading it. It was on a scale. They use I'm assuming millimeters or something so it's essentially a pain scale to 100 or a soreness scale to 100. If you static stretch after your workout,
scale.
It's crazy. After you static stretch, for the 72 hours after your workout, it's supposed to, there was a subjective decrease of 2 millimeters. So if you want a 2% decrease in your soreness levels, stretch right after your workout. So shut up, Ty.
2%.
Definitely probably not clinically significant, but
Not even close.
Yeah.
If it was
I would
80%,
recommend moving more, but
yeah. But that's pretty much it. Boys, good call, Ty. Yeah. But again, I want to thank you guys for coming on. This has been fantastic. I hope all you listeners got some stuff out of it. And if you have questions, clearly the 5 of us love talking about stretching, and we can definitely give our insights into why maybe you shouldn't, or why maybe you should, or how to do it, or when, or why, and all those sort of things. And I just want to thank you for listening to the podcast as well. And if you're watching it, thanks for watching as well. I feel bad they had to see my face, but all these other boys are really attractive. Sans Tim because mustache, but whatever. And if you're not watching this, go watch it, because it's fun to watch our faces. That's pretty much it. Tim?
Yeah, if anyone has any questions, just send us an email, info@motusstrength.ca, and then we'll have down in the show notes everyone else's contact info, whether you're in the Orangeville or Guelph area or the GTA area for Morrow.
Oh yeah.
Yeah.
Beautiful.
Cool.
All right, guys, thanks for listening to the Between Sets podcast. Catch you on the next one.
See ya.
Awesome.